All right, looks like we're live. So welcome. This is my Facebook Live number 5. So if you've been following me, you know that I'm doing a really short, quick Facebook Live daily for physicians and therapists so that you can learn about clinical sleep tips for your outpatient practice. Thank you for joining me live if you're here today, or if you're watching the replay, thank you for that. And you can type replay in the comments so that I know that you were able to watch. So today we're just going to do a really quick talk on CBT-i resources for your patients. CBT-i is cognitive behavioral therapy for insomnia. And if you're a psychiatrist, primary care physician, therapist, you know that it can be hard to find CBT-i practitioners for your patients. I know that I'm hearing from people that it can take 6 months, 8 months, or longer to get their patients in with a CBT-i practitioner. CBT-i, cognitive behavioral therapy for insomnia, is one of the most effective treatments we have for chronic insomnia. It is the first-line gold standard treatment as recommended by the AASM, the American Academy of Sleep Medicine. So I'm going to share a few CBT-i resources that hopefully will be helpful for your practice. If we're meeting for the first time, I'm Dr. Nishi Bhopal. I'm a physician board certified in psychiatry and sleep medicine. I practice through an integrative holistic lens. I have a YouTube channel and online courses teaching physicians and therapists all about really practical clinical sleep medicine that most of us don't learn during our residency and fellowship training. If you are watching, please let me know in the comments where you're joining from, what is your specialty and background, and then what questions or challenges do you have with regard to treating sleep issues in your practice. Okay, so let's talk about CBT-i. As I mentioned, it's cognitive behavioral therapy for insomnia, and this is really what we should be referring patients for if they're struggling with chronic insomnia, even before prescribing medications and sleep aids and things like this. CBT-i, like I said, is the gold standard treatment. It's effective in up to 80% of patients. So it's not for everyone, but it does work for most people. So it can be done in the traditional conventional way that we think about, which is one-on-one with a CBT-i trained behavioral sleep medicine practitioner. So those could be therapists or physicians as well can get training in CBT-i. And so you can do this through your traditional insurance-based model. You can find a one-on-one CBT-i practitioner through local hospital groups, through local practices in your community. It can be done one-on-one, and it can also be done in a group setting. And so many hospitals do offer CBT-i in a group format. Some sleep clinics offer it as well. So I know here in the San Francisco Bay Area, which is where I'm based, UCSF has a CBT-i group. I believe Stanford has a CBT-i group. So there's different groups that you can use. To find a practitioner who does behavioral sleep medicine, you can actually go to the Society of Behavioral Sleep Medicine website. And here you can find a listing of therapists and practitioners who have trained in CBT-i. And you can sort by location, so you can sort by different countries. United States is included on there. They have practitioners all around the world. So this is a way to find people who practice CBT-i. Now, not everyone who does CBT-i is going to be on that listing, but this is a good way to start looking for someone. And you will also find that a lot of CBT-i practitioners don't take insurance. So this is something to encourage your patients to consider because it is kind of a manualized approach. It's usually 8 sessions, sometimes a few more sessions depending on the patient and their needs. But it's a short-term investment that is going to support them long-term. They're going to learn tools and techniques that they can use ongoing, and that can really get to the root of their sleep problems where they don't need to be seeing a therapist anymore. So it's not like your traditional psychodynamic therapy or, regular talk therapy that patients might think of. This is not talking about your childhood and things like this. It is a very specific regimented approach for chronic insomnia. So like I said, you can go to the Society of Behavioral Sleep Medicine website to look for practitioners. But there's other resources also. So I wanted to share some of these because I think as practitioners, we might not be aware of what all is out there. So there are some digital resources, including different apps available. There's a couple of free apps called CBT-i Coach and Insomnia Coach. These were developed by the VA. They're free for anyone to download. They're a self-guided option for people who are struggling with insomnia. And then the CBT-i Coach one is specifically based on the CBT-i protocol. Now, these are meant to be an augmentation to care. So you as the practitioner, you can also download the app and you can work through this with your patient, or you can have them work through it with a therapist or someone else who has an understanding of CBT-i, but you can follow along, use it as an adjunct in clinic with your patients, especially the CBT-i coach. CBT-i coach is based on the therapy manual, Cognitive Behavioral Therapy for Insomnia in Veterans. Insomnia Coach is the other one I mentioned. This was also developed by the VA. It's a 5-week self-guided training program to track and improve sleep. And they will provide tips for sleeping, and patients will input their data and they'll get personal feedback. There's an interactive sleep diary, and there's 17 different tools to help patients get their sleep on track. So those are 2 free resources that you could start having your patients use right away. Now, there's also apps that are paid, and some of these paid apps also offer a personalized live component or a sleep coaching component. So some of the paid apps include Sleepio. So that's one that is actually covered by the NHS in the UK. It might be covered by insurance in the US. Otherwise, the out-of-pocket cost is anywhere from like $100 to $400, depending on the program. And that price might have changed, so I haven't looked at this for a little while. So let me know if there's updated pricing on that. So this is a 6-session sleep improvement program developed by Professor Colin Espy, who is one of the world's leading experts on CBT-i. And it includes community support and weekly live group sessions in addition to the self-guided component. And this can be integrated with wearables like the Jawbone Up wristband and Fitbit. Sleepio is meant for people aged 18 and up. So that's one paid option. There's a new one called Sleep Reset that I've been kind of looking into. That's a paid option as well. So there's a self-guided component in the app. Actually, I think I have the app, so let me see if I can pull that up and show you. And then you also get a sleep coach in addition to using the app. So this one is called Sleep Reset. It's just loading here on my phone. And I'll just show you. So this is what sleep, okay, let me close that out. This is what Sleep Reset looks like. There we go. So that is a paid one, and it has a live sleep coach. And I think that one came out of Stanford, if I remember correctly. Okay, there's another paid one called Somly, S-O-M-L-Y. This one is around $500 or $600, and it's eligible for HSA and FSA, so patients could use that. And it includes one-on-one CBT-i with a licensed sleep therapist for 6 weeks. And then they have their own guided component inside the app. And they do offer a money-back guarantee, so that's something to consider for your patients. And this is meant for patients aged 25 and up. So those were a few of the digital options. A couple of other options are Dr. Lullaby. So this was started by a sleep psychologist who has noticed that there aren't a lot of CBT-i resources available to patients. So this is for patients in the United States, and it's essentially a telemedicine CBT-i service, and they're licensed in multiple states. So they take insurance, plus there's a additional cost. I think it's around pretty low, like $10 or $20 a month for the digital membership. Again, the numbers that I have might be a little bit out of date, so you can check their website for pricing. But patients will get one-on-one CBT-i with a behavioral sleep psychologist. They do CBT-i in addition to CBT for CBT for CPAP adherence. They also do CBT for circadian rhythm disorders. They help patients taper off sleeping pills in addition to offering CBT-i, and they work with pediatric patients as well. So they do CBT-i for pediatric insomnia, and then they also offer imagery rehearsal therapy for nightmare disorder. So this is a really good resource for kids and adults. I know they're licensed in multiple states throughout the US, and it's called Dr. Lullaby. So I highly recommend that as a resource for your patients. Okay, and then another resource is an online resource that was started by a sleep physician, and it's called the Sleep Coach School. And so they offer a community-based program with one-on-one coaching and sleep education for insomnia, and it was started by a sleep doctor. So that's a great resource as well. And they have amazing YouTube videos on insomnia. So if you have patients who are struggling with insomnia, I highly recommend that they check out the Sleep Coach School YouTube channel, and then they can consider participating in their program if they need additional support. And then I'd like to acknowledge a couple of my colleagues who also are amazing with CBT-i. Sarah Silverman Saidi, she's based in Florida, and she sees patients with insomnia and circadian rhythm disorders. And she's also got an epigenetic testing program, which is really interesting for sleep optimization. So you can check out her platform, and I'm just going to pull up her website. It is drsarahsleep.com, and you can follow her on Instagram. And then my other colleague, Tracy Hannigan, she's based out of the UK. Her website is tracythesleepcoach.co.uk, and she's an incredible sleep coach. She herself has overcome insomnia personally, and she has a program for people with insomnia. She sees people globally, and she's based in the UK. So Tracy, the sleep coach. So there's lots of resources available for your patients, depending on what type of platform they prefer to learn in and what they want to engage in, and lots of different price points available too. And then I'll also just offer a few books and workbooks that could be helpful, especially if people want to just maybe start with a self-guided option and then get a sense of what CBT-i is all about, and then maybe do a group option. So there's a book called Say Goodnight to Insomnia. It's a 6-week drug-free program developed at Harvard Medical School. It's also available in audiobook format. Another workbook is Sleep Through Insomnia and the Anxiety and Discover Sleep Relief with Guided CBT-i Therapy. This is a 6-week CBT-i protocol in the book. For clinicians, if you'd like to learn more about CBT-i and how to implement it, there's a book called Cognitive Behavioral Treatment of Insomnia, a session-by-session guide. This is for clinicians. And then Dr. Chris Winter, he's a sleep physician. He has a book called The Sleep Solution, Why Your Sleep is Broken and How to Fix It. It's not a workbook, but it's informational, and it's got different tips and exercises. And that's for patients who are seeking information. And then Jade Wu has a book. Her last name is W-U, and her book is called Hello Sleep, which is also a great informational book for patients who are struggling with insomnia. So in a nutshell, those were your resources. So you can do one-on-one or in a group setting locally through insurance or out of insurance with practitioners in your area. Patients can do a digital option with an app that might have a community and group coaching or even a one-on-one sleep coaching component to it. They can try Dr. Lullaby, or they can work with some of the colleagues that I mentioned, Sarah Silverman, Saidi, Dr. Sarah Silverman, or Tracy Hannigan. And there's lots of other options, Sleep Coach School, and then there's the different books like I just mentioned. So hopefully that was helpful for you just to get a lay of the land of what's available in the world of CBT-i. And then if this was helpful for you, please feel free to share this with other clinicians in your life who could benefit from this information. You can also follow my page to get notified about when I'm going to go live next. You can check out some of my previous lives. On Saturday, we talked about melatonin. Last week, we talked about patient-centered interviewing, differential diagnosis of insomnia, and a few other topics. I'm going to be opening doors to my sleep program next month, and I'll be doing a series of live webinars on sleep supplements in mid-February, so you can stay tuned for that. In the meantime, you can get my free sleep mini course, intrabalance.com/doctors, and it's filled with lots of really high-yield pearls that you can use in your clinical practice right away. I'll put the link in the comments below as well. And I will see you again tomorrow for another live video with some quick sleep tips for your practice. Bye for now.